This video will demonstrate the procedure for administering a blood transfusion to a patient. Before gathering supplies, go to the patient room, perform hand hygiene, and assess vital signs. Vital signs have been obtained and they are in normal range for this patient. Contact physician if vital signs are abnormal. The nurse will ID the patient, explain the procedure, check the doctor's orders for a blood transfusion to be infused over 2 hours, and verify informed consent has been obtained. Health teach the patient to notify the nurse immediately regarding any signs of a blood transfusion reaction, such as shortness of breath, itching, flank pain, or chills. The nurse will then perform hand hygiene and gather supplies. The nurse will obtain one 10 ml syringe of saline, blood tubing, a 500 milliliter bag of normal saline, alcohol, clean gloves, and goggles. In the patient's room, the nurse will perform hand hygiene, open the blood tubing package, and turn off all clamps on the blood tubing. She will now open the 500 milliliter normal saline bag and spike the bag with the tubing. Hang the bag of normal saline and open the upper clamp and fill the drip chamber about 1 inch above the filter. Then open the lower clamp and prime the tubing, being sure there is no air bubbles in the tubing. Labeling the bag and tubing is not indicated because the procedure will be completed in less than 4 hours. Don clean gloves, alcohol the proximal port on the CV line. This is the preferred port for blood transfusion. Attach the 10 ml normal saline syringe. Unclamp the CV line. aspirate, looking for blood, and flush with 10 mL of normal saline or according to agency policy. Alcohol swab the port. And connect the normal saline IV solution. Start the IV at a KVO or keep vein opened rate or according to agency policy. Give the patient their call bell, maintain their safety. The nurse is now ready to go to the lab to obtain the blood. Take the requisition slip to the lab. Wear gloves when handling blood products to obtain the blood component. Hi, Sharon.
Good morning. I'm here to pick up Harriet Heckman's blood. She's in room 214-2.
214-2.
And her date of birth is 1/17/1942.
1/17/1942.
Medical record number's 23231.
Okay.
It's packed red blood cells, AB positive.
Correct.
And the donor number is 2121515.
Okay, that's it. The expiration date's on there if you want to give that a look over.
Yep. It's good.
Checking it for any bubbles or any
Yep, it's good.
sediment.
Thank you.
You're welcome.
Good morning. Can you tell me your name, please? Harriet Heckman. We're going to give you your 1 unit of blood. This is Mrs. O'Keefe. I need a second nurse to verify that we're giving you your blood. Can I see your name band, please? Harriet Heckman. Date of birth 1/17/1942. Room 214-2. Medical record 23231. And the consent is signed, so we're going to make sure that you had signed it. That is correct. And we're going to verify against the requisition form. Harriet Heckman, 214-2, date of birth 1/17/42. Patient's medical record 23231. Packed red cells, AB positive. The blood donor number is 2121515.
Okay, looks good. Nice meeting you, Mrs. Heckman.
Thank you, Cindy.
The RNs at the bedside compared the patient's name, medical record number, date of birth, blood type, and RH factor against the component and the requisition slip. The nurse will now don goggles to prevent blood splash into the eyes. Spike the blood. Clamp off the normal saline. Unclamp the blood and squeeze the drip chamber. Let the blood run down to CV line and then set the drip rate. The student will calculate the drip rate during the evaluation. Adjust rate of blood flow to 1 to 2 milliliters per minute for the first 15 minutes of the transfusion. It can be run at 20 drops per minute to start for 15 minutes. This will minimize any transfusion reaction. Remain with the patient and check frequently for signs of reaction to the blood transfusion for the first 15 minutes. during the transfusion. Stay alert for signs and symptoms of a reaction, such as fever or chills, flank pain, vital signs, changes in nausea, headache, urticaria, dyspnea, and bronchospasm. After the first 15 minutes, check the vital signs. If no signs of reaction, increase the infusion rate, which may be slower with elderly or patients with cardiac complication. The order is for the blood to be infused over 2 hours. Blood should be fully infused within 4 hours. Give the patient the call bell and check patient frequently before the transfusion. When blood is finished, clamp off the roller clamp on the blood and unclamp the normal saline. Infuse the normal saline to infuse the remaining blood at the same rate through the line to ensure infusion of all blood product. Once all the blood has infused and the line is clear with normal saline, the nurse will obtain a 10 milliliter syringe and a 20 gauge needle, a 10 milliliter syringe of saline, an end cap, and heparin 100 units per milliliter vial. Prepare the heparin syringe. Draw up 1 milliliter of heparin into a 10 milliliter syringe. Use the 10 milliliter syringe filled with normal saline to prime the end cap. Prime end cap, being sure that all air has been removed. Place it back into the sterile container and set it aside. The nurse will perform hand hygiene, apply clean gloves, clamp off all clamps on the blood tubing, clamp off the CV line, proximal port, disconnect the tubing and end cap from the CV line. Replace the end cap. And unclamp the CV line. Flush the new end cap with 10 milliliters of normal saline using sterile procedure. Alcohol proximal port. Flush with 1 milliliter of heparin, 100 units per 1 ml, in a 10 milliliter syringe. Clamp the tubing, then remove the syringe. remove gloves, perform hand hygiene. The nurse will now assess vital signs and document. Discard blood bag and tubing according to agency policy, perform hand hygiene, and document. If another unit is to be administered, generally wait 20 to 30 minutes between, except in emergency situations.